Should you say STI or STD, and why? When talking about infections passed through sexual contact, you might wonder whether to say sexually transmitted infection or disease. Both terms are common, but they actually mean different things. Understanding this difference helps us communicate more clearly and reduce stigma. An infection is when bacteria, viruses, or parasites enter the body during sexual activity and begin to multiply. Many of these infections do not cause symptoms right away, or sometimes never cause symptoms at all. For example, someone can have chlamydia or human papillomavirus without knowing it and still pass it on. An infection becomes a disease when it causes noticeable health problems or symptoms. For instance, if human papillomavirus leads to genital warts or cervical cancer, then it is considered a disease. Not all infections turn into diseases because some clear up on their own or are treated early. The reason this distinction matters is because many sexually transmitted infections are asymptomatic. Using the term infection highlights that people can carry and spread these conditions without feeling sick. The term disease can imply that someone is visibly ill, which is not always true. This can cause unnecessary shame or misunderstanding, making people hesitant to get tested or seek help. Health organizations like the Centers for Disease Control and the World Health Organization now prefer the term sexually transmitted infection because it is more accurate and inclusive. It emphasizes that many infections are silent and can be caught early with regular testing. This approach encourages people to get checked even if they feel healthy, which can prevent serious health problems later. Using the word infection also helps reduce stigma by framing these conditions as common health issues that can happen to anyone. It reminds us that sexually transmitted infections are widespread and often manageable. So, in everyday conversation and health discussions, it is better to say sexually transmitted infection rather than disease. This promotes openness, encourages testing, and supports better public health outcomes. Remember, if you think you might have been exposed or are worried about an infection, always talk to a healthcare professional for proper testing and advice.